I'm Dr. Kavitha Gautham, Infertility Specialist, Bloom Fertility Center, Velachery, Chennai. Today we're going to look listen to endometriosis. Endometriosis is a very common disease for which women come to the infertility clinics. Second common probably after the polycystic ovarian syndrome. So endometriosis, I think everybody should understand the basic concept of the disease. So endometriosis is a disease in which the endometrial glands, which are represent inside the uterus, that is the endometrial lining of the uterus, moves out through the tube into the ovaries and any other part of the uterus. It becomes any other part of the abdomen. So it can be seen implanted on the intestines. It can be seen implanted over the bladder. It can also be seen implanted over any of the organ inside the abdomen. So endometriosis is a condition where the woman develops pain during her periods. It is a cyclical pain, and the pain occurs at all the sites where the endometrial glands have got implanted. So the symptoms of this disease varies, and women present with various symptoms, which is more cyclical. And to know about the incidence of the disease, around 2 to 5% of women world over are affected by this endometriosis, and around 20 to 50% of women seeking infertility belong to this category who already have endometriosis. And there is no racial or socio-economical differences in this group, and there is a little bit of genetic predisposition. That is, if in case your mother, or if there is someone in your family who is affected with endometriosis, there is a lot of chance that you will also get into this particular disease. Going into symptoms of the, why you get into this kind of transformation of this endometrial glands outside, why it is happening. If you listen to the theory, there are different theories which has been proposed, but nothing is definitive. So we don't know why these glands are moving out of the uterus into the other parts of the abdomen. So there is no particular theory proven yet. And the symptoms for this disease is majorly the pelvic pain, infertility, and sometimes you can have a pelvic mass. When there is pelvic pain, many of the young girls who are attending school will have severe menstrual cramping or dysmenorrhea. So these young girls have always been on given medication only for the pain, but as time goes, we have found that these girls get into this disease called endometriosis. So the predisposing factor for pain during menses is majorly endometriosis. So this is a problem which occurs early, or shows a symptom very early in the young age itself. And once you identify that you have an endometriosis, the next thing is, it is not going to be a life threatening disease, or it's not going to be a disease which is going to change into a cancerous pattern. Only thing the disease can do is it will affect your reproductive system. So since it is going to affect the reproductive system, there is a chance that you will have a delay in conception, or subfertility or infertility. So hence, once you identify that you have endometriosis, these young girls should plan their marriage early and plan for their pregnancy very early in a younger age itself. That is before they are reaching 30 years of age. So this is very important, because this is a disease very restricted to reproductive system alone, and especially for women. It doesn't happen in men at all. And looking at the disease, we have this is the uterus and tubes and ovary in a laparoscopic picture. What happens during endometriosis is, these cells which are inside the uterus move through the tubes into the ovary, and wherever the cells get implanted, they will start secreting or secreting blood whenever this woman has her periods. So once they start secreting this blood during inside the abdomen, the next thing which happens is the organs inside the abdomen, especially her pelvic area, the tissues which are surrounding the ovaries and tubes will get attached to this blood or blood products, and then it causes a feature called adhesions. So these adhesions happen around the ovaries, and that will affect the mechanical movement of this egg from the ovary to the tube to the uterus. So it causes a mechanical disturbance, and definitely that will lead to infertility. And it can also cause a cystic change in the ovary called the chocolate cyst or endometrioma. So young girls who have chocolate cyst or endometrioma, when they get the surgery done, I think these girls, it is better to get into marriage faster and then plan for their pregnancy as early as possible, rather than taking a lot of time or delay, because this is a disease which is very progressive. There is no standpoint for this disease, or there is no medication where you can keep this disease at one particular stage itself. So since it's a progressive disease, definitely we should plan for the pregnancy as early as possible once you identify the disease. So these disease, when you look through a laparoscope, you can see as a small nodules. This is the early stage of the disease. You just see as a black or bluish nodule. So this is the first stage. When we see through a laparoscopy, we generally remove these nodules just by excision through a scissor or through cauterization. And this is a picture where you see the simple adhesions happening, where this is a place called the uterosacral ligament, where the disease is causing the early changes in these ligaments and this tissue surrounding it. Looking at the diagnosis of this disease, it is not easy to diagnose this disease. Very rarely that when we do a physical examination, we can palpate a nodule in the vaginal area. Otherwise it is difficult to diagnose by simpler method. And ultrasound sometimes only when you have a cyst or a chocolate cyst we can identify the disease. There are so many women who will not have a cyst, but then they will have endometriosis. The early stage of endometriosis and the very late stage, that is stage 4 of endometriosis, cannot be sometimes diagnosed by just doing an ultrasound alone. So the definitive gold standard diagnostic procedure is laparoscopy. Only when you look through your own eyes you will be able to identify this disease. So this is one of the major reason why laparoscopy is mandatory for many of these infertile women. So laparoscopy is gold standard. Only when we do laparoscopy we can stage the disease also, whether she belongs to stage 1, 2, 3 or 4. Stage 1 is minimal, stage 2 is mild, stage 3 is moderate, and stage 4 is very severe disease. So stage 1 you have mild nodules or spots of endometriosis here and there around the uterus, on the uterus, and it can be on the surrounding tissues. Stage 2 is you have mild adhesions around the ovaries and also nodules and these spots in and around the uterus. Stage 3 is you will have chocolate cyst or endometriotic cyst and severe adhesions around the ovaries, and definitely these women will have a period of infertility. Stage 4 is almost a frozen pelvis. The entire reproductive organs are sticking to each other. It is sticking to bladder on top, it is sticking to the intestine, colon and rectum behind, and the entire pelvis anatomy is completely gone, and this is the most severe stage of the disease. When you come with infertility, we plan the treatment according to the which stage you belong to. If you are belonging to the simple stage 1 of the disease, probably we will be planning only simple treatment. Probably we will advise you for a natural conception. Maybe we will ask you to plan for pregnancy early. Or we can take up the basic treatment, that is timed intercourse. We will make sure that you form the follicle for that month and make sure that you have an intercourse at the right time. So this will be the basic treatment for mild stages. And the other important thing is when the disease progresses, it also affects the egg quality, the oocyte quality. When the egg quality is getting affected, again there will be delay even if you start with the basic treatments. The stage 2 and stage 3 endometriotic patients, initially laparoscopic excision should be done, and once the laparoscopic excision and once you know that the anatomy of the pelvis is still retained, probably we can go with the mild treatment or the second level of treatment where we will be putting these patients into IUI. IUI is intrauterine insemination of the sperms. This can be tried for 3 to 6 cycles. If there is a failure with IUI 3 to 6 cycles, beyond which doing the same treatment will not help these women, and these women should be moved to IVF as early as possible. And if the woman is identified to have stage 4 disease, then she will never conceive naturally. She cannot conceive through simpler techniques where the natural process is involved. She will definitely have a pregnancy only through IVF or ICSI. So definitely these people, without wasting time, you have to move them faster to IVF treatment, where the chances of pregnancy is little better. When the husband's sperm and husband's parameters are fine, and it is only the woman who is affected, and it is only endometriosis and the uterus is normal, definitely the chance of pregnancy is very much higher for this woman. But definitely doing it in the younger age, doing an IVF procedure in a younger age itself is more successful, gives a better success to these women. Probably we can guarantee a result around 40 to 50% for these women. Thank you.